Have you ever been in a conversation where you said the right words, but the other person still didn't get what you meant? Or maybe you struggled to understand jokes, sarcasm, or when someone is hinting at something without saying it directly. If yes, you're not alone, and for some people, this isn't just occasional confusion. It's a real challenge called social pragmatic communication disorder (SCD). People with SCD have no trouble forming words or understanding grammar, but they struggle with the social rules of talking. For example, they might talk too much about their favorite topic without noticing the other person is bored. Or they might take everything literally if someone says, "It's raining cats and dogs," they may look outside for falling animals. This makes friendships and school life tough. But the good news with support, people with SCD can learn better ways to connect. So what causes SCD? We don't know the exact reason yet, but it's not because someone wasn't taught enough social skills at home. It's more about how the brain develops. Imagine your brain is like a computer. The hardware works fine, you can type, read, and save files. But one program, like the social communication app, isn't running smoothly. Researchers think genes may play a role. If a family has a history of language or social challenges, a child might be more likely to have SCD. It's also common in kids who are late talkers, but it's not caused by being shy or rude. It's a real brain-based difference. And no, it's not caused by too much screen time or bad parenting. It's something you're born with, much like being left-handed or having curly hair. How do you know if someone might have SCD? Let's play a quick "What would you do" game. Imagine your friend says, "I love getting homework on Friday," with an eye roll. Do you think they're happy or annoyed? If you said annoyed, great. But someone with SCD might say they're happy they took the words at face value. Here are common signs. They might not know how to start or end a conversation, might talk too formally at a playground, or miss body language clues like eye rolling or looking away. They may struggle to retell a story in order, or adjust their tone, like using a loud voice in a library. These aren't choices, they're gaps in understanding the how, when, and with whom of talking. Kids with SCD often feel confused in group chats, get teased, or seem odd without knowing why. There's no blood test for SCD. Diagnosis comes from watching how someone communicates in real life. A speech-language therapist might ask the person to explain a picture, retell a story, or act out asking a friend to play. They also talk to parents and teachers. For example, does your child interrupt a lot, or do they struggle making friends? Importantly, doctors check to rule out autism, because SCD is only diagnosed if autism isn't present. Treatment, no medication, but therapy helps a lot. Kids learn through fun role plays. For instance, they practice reading facial expressions with cards or act out how to join a game at recess. Group sessions help them practice real talks. Parents can join too, learning how to gently point out, "Look at her face. Do you think she's interested?" Over time, these skills grow. It's like learning the hidden rules of a new game. Right now, we can't prevent SCD because it's linked to brain development before birth. But early support can prevent bigger problems later. Think of it like wearing glasses. You can't prevent bad vision, but early detection stops headaches and poor school grades. The best prevention is early help. If a toddler isn't responding to their name, avoiding eye contact, or not showing interest in playing with others, getting a speech check up early can make a big difference. Talking, playing, and reading with kids from an early age helps all children build communication skills. For at-risk kids, this daily interaction can strengthen their social language, kind of like a vaccine for communication struggles. Science is moving fast. Recent studies use video games and apps to teach kids with SCD how to understand emotions. One cool app shows cartoon faces and asks, "Is she mad, sad, or just thinking?" Kids earn points as they learn. Another study found that training teachers to use social pause, like waiting a few seconds after asking a question, helps kids with SCD respond better. Researchers are also looking at brain scans to see which areas light up during social tasks. This could lead to more personal therapies in the future. Also, telehealth therapy, online sessions, has grown, making help easier to reach, especially in small towns. The future, more fun, tech-based tools that make learning social skills feel like play, not work.